Okay, so we're gonna go ahead and get started. All right, so thank you all for joining us today. We are gonna talk all about healthcare for employees and benefits and how we can make things much more affordable. So my name is Monica. I am a family nurse practitioner and also the owner of Impact Family Wellness. We are a direct primary care office located in the Central Texas area, and we are basically revolutionizing healthcare. So if you own a business or you have even remotely looked into insurance recently, it is outrageous. Premiums just continue to go up and up and up. And unfortunately, the benefits continue to go down and down. And so a lot of employers are offering high deductible plans, which is great that you can offer that, but there's a lot of out of pocket cost to the employees after you've paid your premiums. It seems like you pay these giant premiums and then it doesn't cover anything. And so when your employees have to pay out of pocket, then they are less likely to go and get the healthcare that they need. So we're here to talk about alternatives of how we can provide exceptional healthcare and keep some money in your pocket. A lot of these plans, they also fail to provide primary care. So finding a primary care provider in this country is very hard. The average wait time to see a PCP is 29 days. And so if you can't get into primary care, then your employees end up going to urgent care or the ER, and then that's what makes your premiums go up. So for those that don't understand how that insurance-based world works, and disclaimer, I am not an insurance agent, so do not take anything I say here today verbatim and try to take it off to the world. But this is my understanding of health insurance is that you pay this premium. So let's say you pay $1 million in your premium and you've got this bucket of money, right? Well, every time one of your employees goes to the doctor, it dips in that bucket. So every office visit, every lab fee, every prescription, every trip to the ER, urgent care, it dips in that bucket and it empties it out. And when that bucket is empty, then your premiums go up. And that is how they determine your premiums for the next year. And insurance companies can only get so much profit off your premium every year. I believe it's 10 or 15%. That's what the actual insurance company can take. And so it behooves them significantly to increase your premium. And I don't know if you have tried this, but I'm going to assume you don't have any control over what that premium is. And so we're trying to figure out a different way to get people better healthcare and more affordable. So if you've never heard of direct primary care, what direct primary care is unlimited primary and urgent care. It's much like a gym membership. So we are a privately owned office. I am the owner, and we just take care of our members. When patients become a member of our office, they get unlimited office visits, annual physical lab work, telehealth visits, all of it's included. We're not here to nickel and dime people. It's just not what we do. And so by allowing patients access to the office and access to a person that knows their name and access to somebody that they trust, we greatly decrease all of those other healthcare costs. So now, not only are you not dipping into the bucket for every office visit, all those sick visits, all those refill request visits, now we're actually keeping that bucket full for when things do get terrible. So what direct primary care can't do is surgeries, colonoscopies, urgent care stuff that is above and beyond our scope, right? So if you need your appendix removed, I'm not your girl, if God forbid you get cancer, that is where health insurance comes into play. That's where it's important. But for all those day-to-day things, that's not what your health insurance was meant to be. And so we help take that barrier to entry out. And so all of our patients can schedule an online appointment. They can schedule it the same day. They see the same person every time. And we do 70-ish% of what we do via text message. There's a time and a place we have to touch a patient. We can't do a pap smear from afar. We can't listen to your lungs from afar. There's a time and a place you have to come. But there's a lot of things we can do via text message, from UTIs to pink eye to rashes to even refill requests. The reason your insurance-based provider makes you come in is because that's how they get paid. But if we're getting paid regardless because you're paying a monthly membership fee, we don't require you to come to the office for every little thing. Of course, you're always welcome to come, but you don't have to. So we give your employees unlimited access to the office with care that they can get today so that they are in your office more than they're in mine. So not only do we decrease the need for emergency rooms and urgent cares, but we also reduce absenteeism. And so we reduce all of this because we're here for them. So instead of waiting 5 days when they're sick until they get really sick, they'll call us the first day. And then we can get them the help that they need so that they aren't ending up in the emergency room or in the ER. They have a trusted person that they can talk to. One of the biggest benefits about direct primary care is that we do healthcare and not sick care. And so we actually want to keep you healthy. One of the best things about our office is our annual labs. This includes diabetes screen. It includes a hemoglobin A1C, all sorts of things that we really want to know as a healthcare provider. And these are all included for our patients. We're also advocates for our patients, just like whatever business you're in. So if you're a plumber, you don't expect me to know how to clean it, how to fix a toilet, right? And I should not expect my patients to know how to navigate this system we call healthcare in this country. And so we are here to be advocates for our patients and really help them out and make sure that they're getting the care that they need, and also at transparent pricing. Another benefit we have here is we have a contract with a local lab to get labs at about a 90% discounted rate. So when a patient comes in to us and says, I'm just not feeling well, I would really like to get my hormones checked. Great, that'll cost you $27. Where in an insurance-based system, you have to have the right code to get that lab approved. And even if you have a high deductible plan, you're going to pay out of pocket for that. It's going to cost you hundreds of dollars. And by the way, they're not going to tell you what it's going to cost before you go. You're just going to get a surprise bill. So we get rid of all of those barriers. You know how much time it's going to take you. You know who's going to be on the other end of the phone call. And you know what the cost is going to be, which most of the time is nothing. And so by taking those barriers out, we can keep your employees healthier and keep them in your office instead of ours. So how does direct primary care work best? If I had my ideal world, we would be a combo with a high deductible plan or health share, something for those catastrophic coverages, or even something supplemental like AFLAC. These are all great options to pair with direct primary care to get all encompassing care. So that's the ideal world, but those are also not cheap. And so we understand. But what we do is make direct primary care affordable. At the time this is being recorded in 2025, our memberships for businesses are just $60 per employee per month. And so for $60, you can give your employees unlimited access to our office. We do have 3 office locations currently: Cedar Park, Liberty Hill, and Thorndale. But if you don't live in Central Texas, this is also an option. There are about 3,000 offices like ours across the country. Now, I'm going to tell you, ours is the best, of course, but there are other people doing this as well. We're here to take care of patients. It's a much better situation, not only for the patient, but also the provider, because we now get to take care of humans like we always wanted to. In your average insurance-based practice, providers have on average of 2,500 patients. Here in direct primary care, our providers are limited to only having 500, which means we actually know your name. We know what's going on with your life. We can talk about all the things from sleep to stress to nutrition, everything in between. Now, I know it sounds too good to be true, but I promise you that it's not. We have over 2,000 members and we work with over 85 businesses currently to provide exceptional healthcare and keep people healthy. You need that person to talk to. How many times do you see on social media that people are like, oh, my kid has this rash, what do I do? Maybe they should ask a healthcare provider and not Facebook. Don't get me wrong. There's some really great moms out there who are willing to give you some advice, but there's also some crazy people out there that have no clue what they're talking about and have no education in this. So how great would it be if you had a primary care provider that you could just text directly? And yes, our text messages go directly to our providers. We don't have medical assistants. We don't have nurses. We just have providers. And so you get a response from your provider within 2 hours instead of 2 days. You could be dead by the time they respond to you. So we're here to make healthcare more affordable without breaking the bank and all the things in between. So let me see if we have any questions. I know I just did a lot of word vomit there. Okay, here's a question. Who has to pay for this membership? Okay, so here at Impact Family Wellness, we get paid in full by the business owner. So if you have 10 employees, we're going to send you an invoice for $600 and you're going to pay me directly. It's up to you if you would like to pay part of that or none of it. It would just be deducted from their paycheck. We do allow people to add dependents, so you can add additional adults for $60 and kids under the age of 20 for $30. We also don't care about your marital status. You can add your girlfriend, your fiance, or you can add your family member down the street. We don't have to deal with all the rules of ERISA and COBRA and all of those contracts. And so we're able to just be humans and have a real conversation. The answer to your question of who has to pay for this is that the business owner pays us up front, and then whatever they don't want to pay for the employee, they would deduct from their paycheck. Let me see any other questions. How does this compare cost-wise to traditional insurance? So we briefly touched on cost, that our cost currently in 2025 is $60 per employee per month. Most traditional health insurances are going to be well over $400. $400 is kind of the cheapest I've seen, but based off of your pre-existing conditions and all sorts of things, the number of people you have on your plan, I've heard of people paying well over $1,200 a month for a high deductible plan. And what people don't understand is what a high deductible means. So if your deductible is $5,000, that means you're going to pay out of pocket for every single thing you do in the healthcare system, with the exception of preventative, so your annual physical, a mammogram, or a colonoscopy, if they're coded correctly. You're going to pay out of pocket for everything except for those things until you reach $5,000. And then at $5,000, there's typically a split, usually 80-20, where the insurance company will cover 80% of your future costs versus 20%, and then you'll continue with 20% until you reach your out-of-pocket max, which is, typically another $3,000 to $4,000. So not only are you paying your premium every month, but then you have to pay your deductible and then get to your out-of-pocket max. So oftentimes your insurance company is the winner in this because they get to keep your premium, you pay for your own health care, and then they'll kick in if something catastrophic happens. But how many people actually have catastrophic things that happen? Not as many as have insurance. And so we're here also to keep you from having that catastrophic thing. So that is helpful. Any other questions? Do employees have 24/7 access to the provider? No, we do not claim that we are here 24/7. You can have unlimited access to the office, which means you can come in as many times as you want, but we are not an emergency room. We are here for your day-to-day things. But if you call us after 9 p.m., you're probably not going to get an answer. And to be honest, the only thing I can tell you at that point is to go to the ER. So if it's important enough that you're calling me at 2 a.m, you probably just need to go to the ER. We are not concierge medicine. The difference between concierge and direct primary care is concierge typically charges you around $1,200 a month, and they're going to bill your insurance, where DPC is much more affordable at just $60 for our employers. And so we are here to help, but we also are moms and we have children and husbands and lives outside of here. So no, you don't get 24/7 access, but we are here to help. You can send us a message at 11 p.m. and we'll get it the next morning when we open at 8:30. But no, we do not have that 24/7 access. What happens if an employee already has their own doctor? So that's a great question. If you have an employee that has a great provider that they have a great relationship with, they can get what they need, they don't have to pay out of pocket ridiculous amounts of money, and they can get all the things they need, then I have nothing to offer them, and they probably should not opt into our plan. I'm going to say that most of your employees likely don't have that sort of relationship with their provider. So more often than not, people are more than willing to switch. Typically what happens is we get one employee in the office, and then they tell all their fellow employees how great life was, and then they all come over. So there is a time and a place where they may want to keep their physician or nurse practitioner provider that they already have. So another question, how quickly can I implement DPC for my business? Today. That's the answer. Invoices from our office are sent out on the 1st of the month, but they aren't processed till the 8th of the month. So in the ideal world, all of your employees would be signed up by the 8th of the month. But if you come to me on the 16th and you're like, hey, I want to do this, I want to do it right now, we can prorate out that last 14 days of the month. Likewise, if you're already on our plan and you have an employee that joins and you need them to be added and seen quickly, it just takes a quick text message or phone call and we can get them added and seen within a very short period of time. So, can I offer DPC to part-time employees or contractors? Absolutely. So as I said, we don't care about marital status or any of those things. So it is completely up to you as the business owner who gets offered this and what part of it you cover. So whether they're 1099s, they're part-timers, they're W-2s, or they're just some person who comes in and, cleans the floors for you. I don't care who they are. If you want them on your plan, you can put them on your plan. You just have to pay for them. And then if you want them to pay something else, then that's on you to decide. Okay, can I offer DPC without providing traditional insurance? And does this count as insurance? So yes, you can absolutely offer direct primary care without an insurance plan. In fact, that's what most of ours do. Now, this question of if it counts as insurance is that if you are an employee or an employer that has more than 50 employees, you are required by law to offer some form of health insurance, and our plan does not count. So you would still have to offer some sort of plan, but how attractive you make that to your employees is really up to you. So we do have a few employers that offer a high deductible plan and they offer us, and they have figured out how they're doing it. So most of them will say, we'll pay half of your high deductible plan and half of your DPC. Or if you don't take the high deductible plan, we'll pay all of the DPC. The cost comparison is not even remotely apples to apples. And so that would be a decision for the business owner to make themselves. So thank you for that question. Any other question? Okay, so the question is, if I am on my spouse's insurance and I provide direct primary care, does that mean I no longer qualify? And so in many situations, if you are on your spouse's insurance, but then you work for an employer that also offers it, then you're no longer allowed to be on your spouse's. And the answer is no, this does not apply. So my husband works for Amazon Web Services, and we don't have a traditional insurance plan here at my office. And so my membership as a direct primary care patient does not disqualify me for my husband's insurance plan. All right. I think that's about all that we have. So basically, at the end of the day, your employees are by far your greatest asset. When they have easy and affordable healthcare, they are going to stay happier and healthier and more productive. Direct primary care is not just a cost-cutting strategy, it's an investment in your team and your business. Imagine reducing healthcare expenses while giving your employees the benefit they actually love and they will use. It's a win-win. So if you're ready to explore more about direct primary care and impact family wellness, we're here to help you. Just give me a call, let me know, shoot me an email, and we can have another conversation. I'm happy to come out and explain to your employees how we work and what we do and make sure it's something they're interested in. You don't want to pay for something if no one's going to use it. So I would love to chat with you. I really appreciate you joining us today. And shoot me an email if you have any questions, Monica at Impact Family Wellness, or you can shoot us a text at the office. It's 512-537-2177. We also have a ton of videos and more information on our website, which is impactfamilywellness.com. And once again, I appreciate you joining us today. Have a great one.